Hi, and welcome to another episode of Grand Rounds. This is Shanna Miranti. I'm a PA from Naples, Florida, and I am joined by one of my favorite colleagues in acne, Dr. Hilary Baldwin from Brooklyn, New York. Hilary, thank you so much for being here.
My pleasure.
So excited to talk through some cases with you today and pick your brain and find out what would you do. My
Okay.
first case is a young male, a 14-year-old white male with a 2-year history of acne, and he is already getting scarring. He began using tazarotene 0.045% at age 11 due to its low age indication. I like to start young kids between that 9 to 11 age group on FDA approved medications that do have safety down to age 9. So we started him on tazarotene 0.045%. He's a very, very young 14. He is very short statured. He has not gone through any hint of puberty yet, although his acne is
Right.
going strong. But his parents do not want to start isotretinoin because they heard it can stunt his growth. And he's already getting a bit bullied and made fun of because of his short stature. So parents are very against isotretinoin, but I'm very concerned about the scarring. So, what would you do?
Well, we need a full court press here. His scarring is just unacceptable. And we need to stop this in its tracks. Isotretinoin would be my first choice. But the parents are right. First of all, they might be right. There's some evidence that it might actually cause premature closure of the epiphyseal plates, so we don't want to go there. But one of the reasons why we don't want to go there is because the parents are concerned about it, and this child may not get much taller. I mean, you mentioned that he's sort of a late bloomer, and so he might shoot up any day now. But what if he doesn't? What if he ends up at 5'2" and you treated him with isotretinoin? That's going to be a major lawsuit moving
You,
forward.
you
So
don't want to be blamed for that, even
no,
if that
no,
was going to be his height all along.
right, exactly. Because you have no idea. So full court press would mean an oral antibiotic, a topical retinoid, and fulfilling our 4 pillars of acne pathophysiology if we could, to attack follicular hyperkeratinization, inflammation, C. acnes, and sebum production if we could. So I would start him on an oral antibiotic. My favorite oral antibiotic is, especially at this age group, is sarecycline, due to its narrow spectrum of activity and the absence of systemic side effects. I'd start him on a topical retinoid, my personal favorite he's already on, which is the 0.05% tazarotene. So I would probably leave him on that. I don't think we can do any better in terms of efficacy and tolerability, unless, of course, he has lost faith in it. And my rule of thumb is if the patient thinks this stuff doesn't work, I got to move on, even if I don't agree.
That's a
Uh,
great point because they may not comply with it anymore. If they've
exactly.
given up on it, if they are convinced that it is doing them no good, they will not continue to use it.
Right.
So that's a great point.
And you seem as if you're not listening to them and you're
Right.
not responding to their needs. If you say, well, continue using the stuff that you don't think is working. So that wouldn't work. And then some oral, some topical antibiotic as well. So I would maybe go with a combination benzoyl peroxide, clindamycin, a benzoyl peroxide, and adapalene, um, uh, and see where that takes me.
I love where your head's at. So definitely wanted to hit this from the inside out and the outside in. And since his parents were adamantly opposed to isotretinoin, I did begin sarecycline at a weight-based dose. I believe he was on the smallest dose because he was very small at the time. I also had a good conversation with him about androgens and about how hormones could be driving this. And even though he did not have a hair on his chinny chin chin yet, he was likely going going through a lot of hormonal changes, and those androgens were starting to create a lot of the sebum production that was driving some of his acne. So we started clascoterone twice daily. I also, to your point, switched the topical retinoid. I wanted to use something that could help address the scarring that he already had, and triferritine has very nice data for reducing scarring. So with this patient, I went with clascoterone BID and then triferritine on top at nighttime. And within 2 to 3 months, he's having a really wonderful improvement. We were able to pull him off of the sarecycline and continue the clascoterone and topical retinoid, and he was continuing to stay clear.
Wonderful, wonderful. I'm sure you also had him on a benzoyl peroxide cleanser or something to offset the development of
You got
eczema.
that right. Yeah,
Yeah,
this
I'm
case
sure.
was a number of years ago before we had a triple combination therapy topical retinoid option, which contains benzoyl peroxide. So I did have him on a benzoyl peroxide wash. It is so incredibly imperative to always pair any antibiotic, whether it is systemic or topical, with a benzoyl peroxide to
Yep.
reduce the risk of antimicrobial resistance.
Okay. My turn?
Yes.
Okay. So we're gonna stick with the same kind of patient. We've got a 15-year-old boy now with only truncal acne, no acne on his face. We don't see this very often, do we?
No,
Really
it's true.
very, very, very unusual. And so he came with mostly inflammatory lesions, as you can see, a couple of comedones, but mostly inflammatory lesions on his back. And he had used benzoyl peroxide in the past. Didn't work all that well, bleached everything in his house. And he also said that his skin is very sensitive. So we needed something that didn't bleach, didn't stain, and wasn't irritating, and had, I agree with what you said before, I like to see data for drugs when I'm using them. So even, assuming that something works on the face, that it's going to work on the trunk is not correct. So we
Can't
wanted
always make that
something.
assumption. Yeah,
Yes, never
with
make
you. I
that
like
assumption.
the
And the back
data.
is very different. Obviously, the skin is very thick. The sebaceous glands are spread out. They're smaller. So the trunk is not the face. So I want something with some trunkal data. So where would you go with that?
So for this case, and whenever I see primarily truncal acne, especially in a young male, especially in an athlete, and especially in very humid Southwest Florida, I do think about pityrisporum folliculitis. I do think about the fungal acne component as well. So I may try to address that with a sodium hypochlorite cleanser, or potentially add on a ketoconazole or something, short term, maybe even an oral fluconazole for a few weeks, just to knock down some of that fungal acne component. Fungal acne is, of course, all over social media. So a lot of people are talking about it. So as soon as you say fungal acne, the mom starts nodding, and
Right,
so we at least want to kind of, like, even if it's not fungal acne, at
right.
least get that, thought out of their minds. But certainly with truncal acne, we know we have some wonderful topical options that do have data. Both clascoterone and triferritine are two that come to mind, with great data for acne that occurs mostly on the torso. But you're right, it's very infrequent that I see it just on the
Yep,
trunk, unless they are a male of older age that tends to be on testosterone or something like that.
exactly. And sometimes you see acne like this in an older male who sits at a desk chair that has one of those back pads that's
Oh, right.
plastic, and he sweats right there, because this is kind of low, isn't it?
It
It's
is.
it's lower than you normally see up on usually you see it up on the shoulders, and this is kind
True.
of low and all in one area. Sort of smacks of maybe a sporting some kind of a pad or something that they
Right.
wear for football, or again, that plastic chair that people are leaning up against. And I like your idea of making sure there's not pityrosporum. So we went along the route, as you're indicating, of clascoterone, because he's very sensitive. He has very sensitive skin. Didn't like the fact that the benzoyl peroxide bleached. And we have data.
Yeah.
So that's where we went with this. And it was, he had an amazing result.
Fantastic. Well, I love those little tidbits and I always learn so much from you and I really
And I
appreciate
from you.
all those little tidbits that I just step away for a later date. So I hope those of you watching today are able to tuck away some little tips and tricks and remember these for future patients because we all need to help each other out. And Dr. Hilary Baldwin is certainly full of so much wonderful information. So thank you for sharing with us today.
My
And
pleasure.
stay tuned for another episode of Grand Rounds.